Having a baby can be very exciting, and it can spark up all kinds of emotions, from happiness to fear, worry, anxiety, and in some cases you become depressed. Hello beautiful people, my name is Sianoki, and I got a request to talk on postpartum depression, so let's get talking. A lot of new moms experience what we call postpartum baby blues, and this usually begins 3 days after having your baby to a period of 2 weeks, so within a period of 2 weeks. And some of the symptoms include crying, lack of concentration, feeling overwhelmed, either you are eating less or eating more. Basically, you are having problems with your appetite, anxiety, sadness, or you are having trouble sleeping. Okay, and this usually fades within a period of 2 weeks. Now, if after 2 weeks these symptoms persist with added symptoms like restlessness, severe anxiety, and panic attacks, and you are having thoughts of harming yourself or your baby and suicidal thoughts, then we can classify that as being postpartum depression. And if as part of these symptoms you are feeling confused or disoriented and are having symptoms of hallucination, so basically you are hearing voices or seeing things, or you are being delusional, or you have actually attempted, so this time you don't just have the thought of harming yourself or your baby, but you have actually attempted to harm yourself or your baby, then we call that postpartum psychosis, and that is a rare form of it. But if you are experiencing any of these, please seek help. Please, this is urgent, because we have a lot of people who, as a result of the stigma attached to mental health, are very reluctant to see a psychiatrist or a psychologist, and we end up losing some mothers and some babies to PPD. It is very important that the people around the mother also know about these symptoms and notice them, because sometimes the mother herself may not be able to recognize the symptoms and may be in denial. So it is very important that we all know about PPD, the symptoms associated with it, and then help the mother seek help whenever we see any of these symptoms at play. Sometimes in childbirth you have complications, and PPD is just like one of those complications that can be treated. Because of the symptoms attached to PPD, so you may not want to hear the voice of your baby, you may not want to hear the baby cry or anything, and because of that, most mothers feel that they are not good mothers, they feel that they are bad mothers and they are weak. No, whatever you are feeling is normal. There are lots of women going through the same thing, and so you are not alone. And I keep saying that the fact that you worry that you are not going to be a good mom in itself makes you a great mom. Some may wonder what at all causes PPD. There's no single cause. Usually whenever you give birth, your hormones drop and you are likely to feel tired, which may result in depression. Also, emotionally you may be overwhelmed, you are anxious, and that may result in PPD. Any mom at all can experience PPD. However, there are certain risk factors. There are certain people who may be at risk of getting PPD. If you have a history of depression in your family, you are likely to experience it. If you went through stressful events like miscarriage or losing a child, having children with special needs, multiple births, and sometimes as a new mom and you have twins, triplets, quadruplets, it may be very overwhelming. So if you don't have social support, strong social support, you are likely to experience it. People with relationship issues, breastfeeding difficulties, unplanned pregnancies, and financial problems are also likely to be at risk of experiencing PPD. Now, for someone who has experienced PPD in a previous pregnancy, is also likely to experience PPD in subsequent pregnancies. So if you had that history, in case you are going to have a second baby, make sure you talk to your health provider, or as soon as you find out that you are pregnant, make sure you talk to your health provider. PPD, if not treated, can affect the quality of your life and that of your child. So it is very important that we pay attention to it. You are likely to have treatment of psychotherapy, or you may be put on some antidepressants, some medications, and it's okay. Like, just make sure that you are talking to your doctor, you know the side effects of the medications, because most of the medications have side effects, and some patients don't know the side effects of the medication. They just start taking it and they experience the side effects, and that alone becomes a problem. So for instance, if a side effect of a medication is weight gain, and an individual doesn't want the weight gain, then it becomes another problem that has to be treated. So it is very important that you ask questions about the medications, the side effects, you know it, so that in case you are experiencing them, it doesn't come as a surprise. Also, for most of the medications, it's not good for breastfeeding mothers, so you may want to find out whether it's okay if you have to switch from breastfeeding to formula, okay, so that you consider that as well. Also, you may want to know how long you are going to be on the medication, so just make sure that you ask these questions before starting the medication. Some fathers may also experience postpartum depression, usually young fathers or people who are facing financial problems and probably lost a job or something are also likely to face PPD. So that if you are having any of these symptoms that I stated, make sure that you see a health provider, talk to your doctor, talk to your psychologist or a psychiatrist around you. Thank you so much for stopping by. Thank you for joining me today once again, and thank you to everyone that has subscribed to my channel. I appreciate it. God bless you so much, and I'd love to have you on board if you haven't subscribed. As we pursue to become better versions of ourselves, remember that a healthy mind lives in a healthy body. And until I see you again, keep staying safe, stay blessed.